So how much we should add? 2.5 ml. 2.5 ml. So if we add 2.5 ml of reagent 2 into one reagent 1 bottle, then we get how much? 12.5. So how many people will do? Only 12 people. Huh? So we need at least 5 such bottles. Okay? So as we finish, we prepare the next solution. Okay? Now we are waiting for the sample to come from the department, the central laboratory. The sample comes, we start, because we cannot prepare and keep it. We have to prepare immediately before the test. How do you perform the test? Performing the test is very easy. Each test will require at least 90 seconds, each person. Okay. So 15, 90 seconds, how much? Means how many minutes and hours? 25 minutes, almost 1.5 hours. Yeah? So time is ticking. Let's see. We'll wait for the sample to come. তুমি বলো, the principle of AST estimation. এনজাইমেটিক অ্যানালিসিস আমরা দুভাবে করতে পারি এস্টিমেশন। একটা কাইনেটিক, আরেকটা এন্ড পয়েন্ট। দুরকম ভাবে আমরা এনজাইম মাপতে পারি, এন্ড পয়েন্ট এস্টিমেশন আর কাইনেটিক এস্টিমেশন। ওকে, মনে থাকবে? এন্ড পয়েন্ট মানে যেটা আমরা গ্লুকোজ, ইউরিয়া, টোটাল প্রোটিন করার সময় করেছিলাম। There are two ways of estimation of enzyme. Mostly, the enzymes we estimate in our plasma or serum, they are called non-functional enzymes. Why they are called non-functional enzymes? Because these enzymes, their actual or natural substrate is absent in plasma. That is why these enzymes are called non-functional enzymes. Why they are called non-functional enzymes? Because their natural substrate is absent in plasma or serum. That is why they are called non-functional enzymes. But still, they are non-functional because their natural substance is absent in plasma, but their levels may get elevated or decreased due to certain disease condition. So they are produced by some tissues. If those tissues are affected, inflamed, or infected, then the tissue's normal permeability of the membrane changes, and these enzymes then leaks or oozes out from the tissue. If tissue is totally damaged, it pours out. If it is slightly damaged, then it oozes out, drop by drop, like that. So these enzymes, they accumulate in the plasma, and by estimating these enzymes, we can figure out which organ has been affected. Now, most of these enzymes are non-specific, mostly, unless you can corroborate with clinical finding. Say, for example, there is some enzyme is there which is related to cardiac arrest, is AST. Okay, but the patient is not showing any sign of cardiac arrest or MI. Then elevated level of AST may not give the right answer. Okay, because there are many other conditions in which AST might increase, like liver disease, like hemolysis, etc., etc. Mostly they are formed from hepatic cells, but again a part of it again is formed by the cardiac cells. Right? AST is also present in other tissues also. So those tissues might get affected and this AST level might be elevated. So we are seeing the AST level elevated, you can't say the person is suffering from acute myocardial infarction. Understood? Yes, sir. Right. So yet they have some clinical correlation or implication. See, for example, in AMI, there are two sets of markers as per the enzymes are concerned. One is short-term or immediate markers, another is long-term or late markers. Okay? Suppose a person comes with immediate having chest pain in the morning and just now he arrives in the OPD or emergency, then you have to find out Troponin I or Troponin T, Trop T or Trop I, or CKMB or total CK. But if the patient comes to OPD and says that 2 days back he had chest pain, okay, since he was harvesting season, so he has no time. Now today he got time, so he came. So which enzyme would you prefer to estimate? In that case, AST and LDH will come into action because these are late markers of AMI. The onset of their increment starts around after 24 hours or 48 hours from the onset of the chest pain. Okay. They start increasing only after 2 days or 1 day or 2 days. Other markers, why 1 day they come to the normal level. Okay, fine. So these are the ways. হ্যাঁ হয়নি তো, আসি তো, হ্যাঁ একবারই টানবে, ধরে রাখতে হবে না। আর কালকে যেন বলতে না হয়, ব্যবস্থা করে রাখবে ওখানে। আমি আসতে বলেছি, আসিস নি, তুই ভুল করেছিস কিন্তু বলে দিলাম আমি। জীবনীকে বলতে পারছি আমার কথা বলেছিস কি? জীবনী কি বললো শুনতে হবে না? আমি যাচ্ছি দাদা, 1 মিনিট বিন্দু রাখছি। তুই যাবি আমার সঙ্গে, তুই মিথ্যে বলছিস, তুই ঝাড় খাবি। So AST can increase in liver disease as well. Now there are different types of reports you will receive. Liver disease means what type of liver disease would generally show an elevation in AST level? What type of liver disease? Any damage to the normal hepatic parenchyma. Any damage to the normal hepatic parenchyma, be it viral hepatitis, be it cirrhosis of liver, be it alcoholic liver cirrhosis, be it non-alcoholic liver cirrhosis. In that case, the liver parenchyma tissue, normal liver tissue or hepatic tissue is affected. So these tissues then what? Pour out all the AST or ALT into the circulation. So AST will increase. But if there is some obstruction in the biliary canal equity, then this enzyme will not increase because that is related to some other enzymes called alkaline phosphatase. This enzyme is not specific to the obstruction or internal or external cholelithiasis or cholestasis. So this means stone formation, cholestasis is obstruction. Right? So cholestasis can occur intrahepatic as well as extrahepatic. Right? What are the different causes for intrahepatic cholestasis? Okay, they not be both chesta koro bolo. Treatment of malaria. Anti-malarial drug কেউ খেয়ে থাকে তার ইনফ্রাহেপাটিক অবস্ট্রাকশন হতে পারে। 1 নম্বর। 2 নম্বর কি ভাইরাল হেপাটাইটিস হতে পারে, যেখানে টিস্যু ইজ ইনফ্লেমড, ঠিক আছে, স্লাইটলি বাড়ে, খুব বেশি বাড়ে না, দ্যাট রিমেইনস within 10 times of normal URL, within 10 times of normal URL. এসে কত? হ্যাঁ 31 এসে, বাহ গুড। এবার রেডি কর সবাইকে, একটা করে টিউব নিয়ে। কতক্ষণ সময় লাগো? 1.5 মিনিট, তাই তো? হ্যাঁ 4 মিনিট পড়া, দেরি করে খেতে যাবে নিয়ে 4 মিনিট যাই থাকবি। 10 জনের পড়া কজন আছে তোরা? 30 জনের মতন আছে, ও তাতে হয়ে যাবে। বল হবে না? 3 4 12, 120 মিনিট, 2 ঘন্টা পারবি না? তাহলে তোর বন্ধুর সঙ্গে করে নিস, আমার কোনো আপত্তি নেই। It's up to you. ঠিক আছে, খিদে পেলে চলে যাবে। সাপোজ 1টা বেজে গেছে, খিদে পেয়ে গেছে, তোমার টানটা আসেনি, প্র্যাকটিস হবে, পরেও প্র্যাকটিস হবে। আন্ডারস্টুড? না বোঝাই ভালো। ঠিক আছে, so intrahepatic obstructions causes antimalarial drug. Fine. Okay. বেশ কিছু ভাইরাল disease which is not associated with liver, যেমন such as Coxsackie virus infection. এই Coxsackie virus infection-এ কিন্তু hepatic parameters গুলো elevated হয়, দেখে মনে হবে it will look like as if he is suffering from liver disease, jaundice, viral hepatitis, but serology is coming negative, means no viral genome is present in the blood, but the symptoms or the results in the liver function test result will mimic that kind of situation. It is due to Coxsackie virus infection. So remember all these things, small things. Okay. Let's start.